Well, there has been a swift rise in COVID-19 cases in Central Trinidad over the past few weeks. County Medical Officer for Caroni, Dr. Jeanine St. reported the increase at Saturday's Ministry of Health COVID-19 update. Browne-Campbell tells us more.
Several public gathering places have been at the center of the recent sharp increase in COVID-19 cases in Cova. The rise in cases affecting County Caroni were highlighted by County Medical Officer for the area, Dr. Jeanine St. at Saturday's weekly COVID-19 update.
We have had cases generated, and these cases, some of the cases actually generated 41 primary contacts, 154 secondary contacts, and 51 tertiary contacts. And some of these contacts would not just be household persons, but would be officers themselves.
Dr. St. Bernard added that cases of the virus in Caroni doubled from 26 cases on March 3rd to 52 on March 16th.
For the month of March, so far, we have actually had 55 new cases when we add each day's tally for new cases coming to County Caroni. And of those, we have had more than 900 contacts to follow up. Primary, secondary, and tertiary contacts.
The doctor described the venues that were the center of the surge in cases. They were a church, a number of bars, a police station, and an army base.
We are quarantining all primary, secondary, and tertiary contacts. This may sound severe, as Dr. Hines mentioned earlier, but it is something that within County Caroni specifically, we thought it was necessary to do in as much as the numbers were continuing to rise, and they were rising rapidly.
In addition to these measures, Dr. St. Bernard said that all primary, secondary, and tertiary contacts were being swabbed, whether they were symptomatic or asymptomatic. Browne-Campbell, TTT News.
And the weekly average number of COVID-19 cases has been on the increase over the past 2 weeks. Technical Director of Epidemiology Division, Dr. Avery Hines, gave this information at Saturday's Ministry of Health's COVID-19 update.
So whereas we would have had a rolling average that would have been about 3 or so persons per day, over the last couple of weeks we have seen where that average has slowly risen to around 8.
One of the questions asked at the update was whether CXC and CAPE students would have an opportunity to take their exams if they have been quarantined.
With regard to the plan for students who are not necessarily COVID positive, but are contacts, I would leave the response to that to the Chief Medical Officer or to the Minister, because we are actually currently in talks about what is the plan for the students, because we are concerned and we don't want to be caught off guard.
The Ministry of Health has reported 18 new positive cases of COVID-19 in Trinidad and Tobago. The ministry says of these cases, 2 are from Tobago. The number of positive cases reported reflects the samples taken during the period March 17th to the 19th and not the past 24 hours. The total number of active positive cases is 146. There are 9 patients in hospital, 379 in state quarantine facilities.